Hi, Dr. Filidei here, Director of Functional Medicine at the Amen Clinic, with another installment. Today we're going to talk about kind of the benefits of the scans that we do here, which is really critical in determining if you have a toxic brain. So otherwise it's really hard to determine that, which is why so many mental health practitioners just miss it. Miss your mental health problem that's really a physiologic problem. So if you've watched some of my chats in the past, you know that there are many causes of things like anxiety and OCD and depression that are not mental health, really they're physiologic issues, biologic problems like Lyme disease, mold, dysbiosis in the gut, yeast overgrowth, right? A long list of things. So the benefit of the scan is you can actually see a brain problem and determine almost immediately if it's psychological or not. So I want to give you an example of a perfect example of why this is so important. So you can focus in here. This is what a normal brain scan would look like in a healthy person. And this is really at any age and male or female gender. So it should look like that. Now, just an example, so a patient came in that in mid-30s with severe anxiety, panic attacks, and other issues, and if you want to go to a psychiatrist, you might get your Xanax or what other medication, but looking at the scan, looks like this. Now, this is, you can tell there's a big difference, right? So just anybody, a 2-year-old could pick out which brain they want. This one is all lumpy and bumpy, and there's a big problem here. Now, the key about this is that you can't think your way into this, right? Anxiety doesn't do that. Depression doesn't do that. It could be the other way around. The problem in the brain is causing your mental problem. This is called encephalopathic or encephalopathy, which is a sick brain. So again, you don't know unless you look. That's our whole motto. So this is a tip-off that there's something biologically going on with you. And this could be a head injury. It could be mold, it could be Lyme, it could be a lot of things I've talked about already. But again, you have to look, otherwise you're not ever going to find it. So that's where the big investigation happens. I get to play Dr. House, like on TV, to figure out what's going on with patients like this. So that's when I ask all these interesting questions about where do you live, and have you had a mold problem, and how's your diet? Have you had a tick bite? All those things play a role into figuring out what's going on there. So the beauty of the SPECT scans is it makes my job easier because I can see right off the bat if there's a major issue. And so can you, so can the patient. So that's really the benefit of brain imaging, particularly SPECT, because there's a lot of imaging. You can get MRIs and PET scans and things like that, but this is really visual. Again, a 2-year-old could pick out which brain they want. So that's an FYI on why these are so important in what I do and what we do here. And I think we're offering some kind of a special soon on back to school, making sure your brain's healthy going back to school. So just stay tuned for specials like that where you may be able to get your brain looked at, especially if you're not where you think you should be and no one can figure out what's going on with you. So I tend to specialize in figuring out those things. So let us know if you need any help, and we'll be here.